The first death in California was an elderly man. We're learning senior citizens are more at risk for coronavirus. KSBY News reporter Alice Becerra shows us what a local senior care facility is doing to minimize patient exposure. Alice?
Karina, a local assistance living facility, says that the biggest challenge is making sure they're not depriving patients from time with their family while also making sure that they remain healthy. As the reach for the coronavirus grows in the United States, public health officials say seniors are particularly at risk.
The vast majority of the serious illness has been in people who are older, senior citizens, or even older, seniors, as well as people with underlying medical conditions.
Local senior facilities in San Luis Obispo County say they are trying to be proactive and following guidelines from the state. The main policy change informing patients' families about which countries are at higher risk of coronavirus and asking them to inform the facility if anyone in the family has recently traveled to one of those countries.
The challenge, of course, is that this is the home for our residents, and we don't want to deprive them of time with their family. But at the same time, we need to ensure that they're healthy and that they stay healthy.
Another preventative measure includes limiting the exposure patients have to tourists during outings.
That can include anything from a picnic at a beach to, during the summer, the concerts in the park. So our activities coordinator, for example, is thinking of just taking this in mind, thinking about the areas that are more trafficked by tourists, for example, to minimize exposure.
The San Luis Obispo County Public Health Department says that while they understand the public's concern, the coronavirus does not seem to be as infectious as other diseases such as measles or chickenpox.
Now, measles, for instance, for every one person who contracts measles, they may spread it to 20 other people. This disease appears that maybe for every one person who has it, they may spread it to 1 or 2 or 3 other people.
Jennings also says that if he receives any calls from concerned family members, he will walk them through any procedures or policies they already have in place to protect patients. Live in the newsroom, I'm Alice Becerra, KSBY News.